METH is a stimulant that affects the brain, spinal cord and central nervous system. It changes the way the body processes chemicals that act as communicators between nerve cells and brain cells called neurotransmitters. METH enters the brain cells from the bloodstream. It produces a massive amount of activity, which in turn releases neurotransmitters. The neurotransmitter most affected by METH use is dopamine. When dopamine is released, it fits into specialized receptors located on nerve cells in the cerebral and limbic cortex. This creates a rush of euphoria. Additional to euphoria, the main reason of ice use is to achieve positive effects such as elevated mood, energy and confidence. These lead to adrenaline-like effects of increased heart rate and pupil dilation. Although these usually lead to a come-down phase or crash along with the many problems associated with ice use, including brain damage due to chemical imbalance and damaged neurons, mental health problems such as depression, anxiety and psychosis, violent behavior, aggression and lack of judgment, dehydration, malnutrition and exhaustion, increased risk of cardiac, renal, respiratory, dental and social problems, and increased risk of viral and bacterial infections due to needle use. The repetitive use of the drug can also lead to increased dependence and withdrawal.
The National Drug Strategy Household Survey (NDSHS) has stated that the most common abused drug form for methamphetamines is ice. It was rated at 26% in 2007 and has since increased to 50% in 2013. The second most used substance type is in its powder form. The drug usage has dropped from 51% in 2007 to 30% in 2013. The Ecstasy Drugs Reporting System has stated that in 2004, 37% of people in a survey found obtaining ice as very easy. It has subsequently increased to 56% in 2013. The NDSHS also found that 20 to 29-year-olds abuse the drug the most at 7%, while 30 to 39-year-olds were second with 5%. Males also abuse the drug more at 2.5%. compared to females which were at 1.7%. 21-year-old Mandy lost her parents when she was 14, leaving her in the care of her older sister. Mandy and her sister binged alcohol weekly, until her sister and her friends introduced her to ice. Mandy enjoyed ice for the high, and began smoking it daily, even during her work. This caused heavy weight loss, 14.0 body mass index, paranoia and withdrawal, causing her to quit her job. Her boyfriend became worried, and assisted her to an eating disorder and psychological program. Mandy was compliant, and gained up to 19.5 body mass index and stopped using ice, with the help of her boyfriend.
The following are methods of treatments that are currently being practiced for methamphetamine addiction. Intervention, aversion therapy and pharmacotherapies. Intervention basically creates a positive environment for the patient and guides them to adopt a new and healthier lifestyle. Aversion therapy uses positive punishment in the form of an unpleasant chemical or electrical stimulus. These drugs are prescribed to either ease symptoms of withdrawal, be used as a substitution drug, and treat other disorders. An example of this is a substitution of methamphetamine with dexamphetamine. This is similar in principle to giving methadone for heroin. The future looks bright as the National Institute of Drug Abuse is currently conducting studies for potential treatments. Drugs such as Paxil, bupropion and modafinil have the potential to decrease cravings, withdrawal symptoms and decrease abuse of meth. There are many studies being conducted for potential treatments for meth addiction, and all are to make the lives of meth addicts better.